Good afternoon, doctor. You know, I follow Paul Henny, who does an incredible job with his Bob Barkley Study Club postings, and he is a brilliant, wonderful man who really does peg some of the work that's been done over the years and the things that we're all discovering now very beautifully for us all. And I was thinking about this because recently he had posted some information from Avram King, who really was a very interesting individual who was hired in the dental professions, including orthodontics years ago, apparently, to consult and to help them with what was going on in their professions, our professions. And so let me tell you some of the things that triggered me to think about. Avram King actually talked about the health model of our care. And I thought about the fact that basically there are three models. And let me tell you what those are. There is the medical model, which is the doctor takes care of whatever he or she can. There is the educational model, which we might also call a health model, where we teach the patient everything that they need to know to take very good care of their own health. And then finally, there's a third model that nobody was talking about then, but we have to really look at now, and that's the aesthetic model. Now, hear me. Listen to this. The medical model, the doctor takes care of everything, is off the table. You can't do that. How can you do that without the patient complying? Off the table. Hear me again. The educational model is off the table. In general, no matter what our relationship with that patient and parent, the educational model is off the table because they don't do it. Most patients and parents do not comply with most of the things we teach them, whether it's plaque control or appliance wear or anything else. The majority of them have problems with that. So let's take 1 and 2 off the table. Let's take the medical model off the table. Let's take the educational/health model off the table for a minute. And let me tell you something. The patients, your patients, are in the beauty model. Aesthetics and orthodontics, the beauty model. That's where they are. Now, I wrote some notes. Let me just look at my notes here because it's interesting. When I thought about it, I thought about how do we then function in the beauty model? What do we do to make it work for what we need to do for them, what we have committed our life to doing? We want to be able to look forward to our day. We want to be able to look forward to the gifts that we give. We want to be able to help change lives. So again, since we've taken off the fact that education doesn't really do very well for very many people, I'm not saying to stop doing it, but I'm saying to understand that that's not going to be the whole answer. Actually, let me go there for a minute. You're spending your time educating and motivating your patients, and you feel so good about it because you know it helps, you know it works. You're not getting paid for that. And they are poorly responsive. Is that a workable model? That's why I took it off the table and said, in general, medicine in general is fixing and caring for people who are broken. They want to be taken care of. They want bariatric care after eating what they want. They want good health after not having movement and exercise and good nutrition. They want good, healthy, beautiful smiles without being compliant with their own plaque control or their own medical control, such as diabetes and other issues that affect their mouth greatly. They want the quick fix. The personal initiative today is very, very low. So the beauty model is what they come to you with. They come to you with, I want to be gorgeous. We all want to be gorgeous, of course. How can you then deal with that? How can you help them with that? Because they're not even interested, quite frankly, in your implants and crowns. That's a medical model, unless it's something in the front that shows. Even that can be difficult. Even TMJ dysfunction treatments and related occlusal dysfunction treatment is a medical model. And some patients are so desperate that they will work with you on that. But most are more interested in bleaching, veneers, beautiful smiles, and orthodontics. That's what they want. For many, they are willing to couple their aesthetic model with your restorative care because you insist that it's necessary, which it often is. Understand the choices that you have. Understand the choices that you are making with your patients and giving them so they can make choices with you. Looking at the beauty model from a business perspective is interesting because it really works the best for the free market medical dentist. The beauty model does not work well in the patient with insurance. Insurance doesn't cover most of the beauty, but that's what they want. And quite frankly, since it's not covered by the insurance companies, it's certainly not covered by the Medicaid government insurance and all the companies related, they have to pay out of pocket. That's the free medical market or fee-for-service type model. That's where it works the best. And that's why you have doctors who are very successful with this model by targeting people who are willing to come to them and pay big bucks out of pocket. Don't forget, people can afford almost anything they want. They just can't afford everything. So if you're offering them the aesthetic model along with what you know is best for them and the restorative and medical model as a backup, then that's something that they are going to be more willing to think about. Think about the loyalty that they have for that. Think about how much they want it. Think about the fact that our medical model is based on ICD-9 codes, disease codes, not health. Think about this as you plan to help your patients. The aesthetic model in a free market medical situation, fee-for-service situation, relationship-based dentistry where you are loving your patients. Some great thoughts for you, doctor. That's the model that they're interested in. Dr. Chris, signing off.